Well, hello there, Dr. Brian McKay, not just a chiropractor, Stamford, Darien, Norwalk, Canaan, blah, 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 blah. All right. One of the things that's brought to my attention is that, at Core Health Darien, we treat kids with special needs. And it's a wonderful population of patients to work with because the one thing we don't realize when we have atypical children is some of the specific challenges, the physical challenges that exist for the special needs children. And it's very rewarding to work with these kids. We basically do it. We're doing gentle adjustments to the spine and the joints. It helps improve posture, balance, coordination. It also can reduce the pain and inflammation. Now, one thing you want to think about is some of these kids are nonverbal. So when a child is nonverbal, how do they communicate to their parents? Um, they're hurting. Um, that would be my job as a chiropractor is to find these points where I see tenderness, feel restriction, remove it by addressing subluxation. But a lot of times people don't realize that can make the quality of life for these children with special needs just that much better. So while chiropractic care is part of the armament when people are treating children with special needs, but it can be so rewarding when you see a kid's eyes light up, who again may not be verbal, or you can see them moving it better. It's probably the most rewarding segment of the practice that I have. Um, you know, I've heard of there are other chiropractors who treat like animals, and the same thing, like horses. A lot of There's a lot of chiropractors who just treat horses. I, for one, not a big animal lover, so I don't see the need to treat horses. But the owners and the trainers can see a difference in how the horses perform. So again, I'm really using the analogy with the animals and special needs children as being nonverbal. So there's different ways. I mean, applied kinesiology is a method where you use a muscle test to identify which which segments are out of place. Besides palpation, which we actually go and physically feel the joint. So it's something to think about. And how do you improve someone's quality of life? And that's really what it comes down to. It's really, um, first of all, not all people are handy. Our offices are equipped to handle children with special needs. Fortunately, we are. We have the ramps, and some kids are in wheelchairs. And that's the thing too is think about just because someone's in a wheelchair doesn't mean they don't need to be seen by a chiropractor. There could be a lot of tension in the spine